Well, good afternoon, everybody, and welcome to today's RCSLT webinar, Being Sherlock, Finding the Answers to Clinical Questions. To any of you who've logged in hoping to watch an episode of Sherlock during your lunch break, I apologise that isn't what's going to happen, but I assure you it's going to be just as gripping. Got a particularly far-flung selection here. Colleagues from Hong Kong, hello. Colleagues from Singapore, hello. Please do chat with us online. It's great to have you with us. My name is Derek Munn, and I'm the Director of Policy and Public Affairs here at RCSLT. That means that I know about many things, but the one thing I don't know about is clinical research. So I too am here to learn today from our presenters, who are Dr Jenny Thomson, Senior Lecturer at the University of Sheffield, and Dr Emma Pagnamenta, who is the Research Manager here at RCSLT. As is customary, I need to do a few bits of housekeeping. The webinar is 45 minutes long. There'll be time for questions at the end, and I'll tell you how to ask a question in just a moment. If you look at the right of your screen, you'll see the name and the names of the panelists. There are many other people online too, although you can't see them all. The host will let you know via the chat stream. And the host, who's called Kaylee, will also keep you updated with anything you need to know through the event. You can use the Q&A button on the right to submit a question for the panel. Submit it at any time. Please send it to all panelists so other participants can see it. We won't be able to see your name. You can use the chat button to send messages either to us here at RCSLT or to other participants. There is a Twitter hashtag for this event, although it's hashtag research, so I imagine there may be some competition on that, but please do tweet away. The event's being recorded and will go online in about a week's time along with the slides. Now, the learning objectives for today are that we hope in around 43 minutes time, you will understand how to select a research article that will mean something for your practice, that you'll be able to navigate and pull out key messages from research articles. You'll understand critical appraisal in action using a tool which is available to speech and language therapists, and you'll know where to find tools and resources to help you apply research evidence to your practice. So, to get us going on all of those topics, could I now hand over to Dr. Jenny Thomson? Jenny.
Great. Hi there. It's lovely to be here. Hello, everyone. So, as Derek says, we're going to be now talking about being Sherlock. You can imagine yourself, for those of you that watch the TV programme, imagine that you'll become like Sherlock, seeing the different clues and putting them together. I think, however, for many of us, while we understand that evidence is important, and maybe we've even dabbled in doing a search on a database, when we get to the point of finding a potentially relevant article, we feel rather intimidated. Articles can look dense, the statistical section might be incomprehensible, and so we don't really feel any wiser whether we look at the article or not. But really today our message is that research articles can be your friends, they really can, and we aim to show you how in this session. In terms of where to start, I tell people studying with us at Sheffield that the Royal College Research Centre is a really great place to go. It's especially the case if you're not linked to an educational institution, because it helps you with accessing more open access sources. And I know from some of the pre-registration questions, this is something that people are particularly interested in. If you haven't visited the Research Centre lately, you can find it within the Royal College members area, and within the Research Centre tab, there are then multiple options. I'll talk about some, and then Emma will guide you to some others later on. However, we're going to focus right now on the Finding Research Evidence tab on the left, and a little below what you can see here. And as it says at the top of this page, with the RCSLT journal collection alone giving you access to over 1,600 journals, you're going to need a way to navigate all of this information. Databases are typically our best way, and this page gives you various options to explore. Databases definitely vary in their usability and their comprehensiveness. So on the more user-friendly end of the scale, we've got resources like Speechbite, which is specifically geared towards collating speech and language therapy evidence. While arguably on the other end, we've got sites like PubMed and Athens that need a bit more work on the user's part. Google Scholar is another option that people increasingly are using, and it really can yield useful information. Though one thing to remember with Google Scholar is that just like searching for a plumber on normal Google, there isn't any quality control. So with the ease of use comes a bit more responsibility on your end to be able to discern the quality of the information that you're being provided with. Because of this, databases like Athens can be safer as the information that they're giving you has got some quality control, but people can find them difficult to navigate. Sometimes you might end up with 5,000 results, sometimes 0. So how can you implement the best search so you get the articles that are most relevant to you? And as speech and language therapists, we actually have a tool that we can use here, in that we can think about our search strategy in terms of information carrying words. So if, for example, you might be interested in, say, the efficacy of a narrative intervention on outcomes for children with language impairments in your language resource base. So let's look at what our key words might be within this question. We might think efficacy could be one, but then this is actually a bit redundant, because if we're looking at an intervention, it's very likely we'll be looking at efficacy or effectiveness. So we wouldn't use that as a keyword, whereas narrative interventions is an informative phrase. So we'll put that one aside and use it. Outcomes is another possible candidate. You might be interested in specifically narrative outcomes or expressive language outcomes, but often it's useful to start thinking about fairly general outcomes in a search, because for many SLT interventions, there may not have been much done, so you don't want to limit yourself too much in what you find. So we won't use outcomes, but we will use children, because we want to know about children in this case as opposed to adults. And we will use language impairments. That's another critical one for us. So this leaves us with 3 search phrases, though to make sure we get everything in our search that's optimally relevant, we're just going to make a few more slight tweaks to these terms. Now, this is where it might start to look slightly scary. So let me guide you through what I've done here. Really, what we're doing when we're searching is we have our idea of what we want, but we need to think then of how the other words or phrases that other people may have used to look at similar things. So, for example, we're interested in narrative, but there might be articles that use the term story instead of narrative. So I'm going to put those words in brackets so that I can cover both of those in my search. Then moving down to children, again, some articles might talk about childhood, some about a child in a case study, some children. And so to make sure that we get all of those, we're actually just going to take the stem of the word and add an asterisk, and then we'll hopefully get all of those in our search. And then finally, language impairment. Clearly, there's many different ways that this could be phrased in terms of language delay, difficulties, specific language impairment. So again, to try and capture everything I'm interested in, I'm going to put a few phrases here into my search to try and get as full a picture as I can. You also want to be careful and think about cross-cultural wording differences. So, for example, using speech and language therapy or speech and language pathology, if you're interested in US studies, these kind of things too. I did actually try this search out on PubMed a few days ago, and it got me about 200 hits. That's quite a lot. So I scanned through the titles of what I had, and sometimes the abstracts as well, to look at the relevance. And I did end up with a manageable handful of articles to look at. But even then, you might be thinking, well, that's all very well, but it's actually, my problem is more when I get to the article, I don't know what to do. So we will have a look at that question next. Once you have some articles, one way to start determining what they can tell you is to consider where they sit in the hierarchy of evidence. You may have seen this triangle before. What's critical about this triangle, which I'm going to explain a bit more in a minute, is that it's not a hierarchy of quality, but it's a hierarchy of generalizability. So let's have a look. Let's start with RCTs, randomized control trials, which many of you may have heard of. And these are often seen as a gold standard of intervention design. The randomized part is that participants are randomized into different intervention conditions, and this is seen to reduce bias in the research design. So given this feature, they're often seen as quite high in the hierarchy of evidence, in that what you find in these studies can be quite generalizable. Above that, we've got systematic reviews of randomized control trials, which take all the RCTs that have been done in an area and make some conclusions about what they can say. So those allow you to generalize even more. On the other end of the scale, we have case studies. And being at the bottom, this doesn't mean that they're not useful or not good quality. It means that they can be less generalizable because we're looking at a smaller number of people. If you're a clinician working with a client where no one in your service has encountered something similar, often within speech and language therapy, given the fact that our evidence base is emerging at the moment, case studies may be all that you can access, and they may be the most useful thing to you in making clinical decisions. So in terms of using this hierarchy in practice, if you're a head of service and need to be thinking about what guidance you give, then you will want to look more for articles which are higher up the hierarchy. Whereas if you're thinking about something for a particular client, case studies also going to be equally valuable to you. I really find this hierarchy useful when I'm looking at articles, because in a way, if I can automatically identify where in the hierarchy an article sits, it then helps kind of free up my cognitive resources to dig a bit deeper into other aspects of the article. And we're now going to take an example from the RCSLT's own journal. In our department in Sheffield, a question that often comes up from students and clinicians regards the efficacy of the Lee Silverman voice treatment for individuals with dysarthria. So if you imagine that I carried out my search through the steps that we've just talked about, and I ended up with a handful of articles, one of which is the one you can see now, this 2011 paper by Constantinescu and colleagues. So if we look at this, if we look at the title, we're actually already given information on where in the hierarchy this article sits. So that's a good start. It's actually telling us that it's a randomized control trial. There is some other information there, and so we're going to come back to that in a minute. But if we really want to know a bit more about this article, we're going to need to go a bit deeper. And one tool we can use is the Royal College Critical Appraisal tool, which I'm going to use to dig into this article a bit more. So here's the front sheet, and there is a link at the bottom in terms of accessing the tool as a whole. And this is available in the Research Centre. And it's great because it prompts you to ask all the right questions, so you don't have to keep them all in your head all the time. And the key thing about using this tool is taking each item in the list. This will prompt you to find the information in the article. And then you want to ask yourself, what can I learn from this piece of information? And then critically, how does it fit with my particular clinical question? And another key thing I want to get across here is that when you're reading journal articles, you don't want to be put off by what you don't understand, but really focus on what you can understand. And I think you'll typically find it's more than you're expecting. And we can actually apply this principle even to the title of this article. If we take another look here, you might be thinking, well, I don't know what a non-inferiority trial is. Like, help! I'm not going to understand this. I'm going to find something else. But I would say, don't do that. Take what you can get here, a randomized control trial, and then find more that you can understand. And as an aside here, all a non-inferiority trial means is that it's comparing the delivery of an intervention online compared to the traditional face-to-face delivery, and it's checking that the online is not inferior to the traditional. The title here also tells us it's looking at intervention delivered online. And again, you might think, well, I'm interested in face-to-face. I'm not delivering it online. But the chances are, if we're looking at an intervention online and comparing it to face-to-face, then this article will tell us about the effectiveness of the face-to-face intervention too. And also articles, when well written, have in their literature review section, they'll always give you a summary of the field. So you can always use that to give you some information and some context. So let's go back to the tool. Here we've got more details from the front sheet. And remember, we're always asking, what can I learn from this and how does it fit my question? As you can see, the checklist goes systematically through the different sections of the article. Some of the questions here are actually related to the clarity of the article. So under introduction, for example, you can see it's asking, is there a description and overview of the content of the study? You might think, well, why does this matter? And checking this serves a couple of purposes. Firstly, it helps you find the information. So it's almost like a kind of reading comprehension check. But then also any lack of clarity on the author's part sometimes does play out as the article goes on in terms of the clarity of the design, the results. So it can just be a bit of a quality check at this stage. But then potentially the most critical part of the article, in my opinion, is the methods, because if this is set up right, then even if you don't understand the stats in the results, if the authors are reporting a positive effect, you can rely on this more. And some key questions here are things like, who are the participants? In the article we're looking at, is it anyone with Parkinson's? Or is it a specific level of severity? How intense is the intervention? Is it 2 weeks where we wouldn't maybe expect anything? Is it every day for a year? So something we couldn't possibly deliver. So these kind of things are important to think about. Also, what are the outcome measures? Are they sensitive enough to detect a change over the period of time reported? Are they going to pick up on the thing that's intervened on? And looking at this article specifically, even within the abstract, we're given quite a lot of information. So here we can see that they tell us that it's 34 participants with Parkinson's, and they specifically have mild to moderate hypokinetic dysarthria. So we have that information. And it also tells us about a range of outcomes that they're using, both quite objective scientific measures like sound pressure level, but then also more functional ones like speech intelligibility. So that might be something that's important to you. They've got a nice mix here. When we've looked at the methods, we're going to think about the results, which I think often scares people the most. But as I said earlier, with this section, my philosophy is really find whatever you can in this section that you can understand, and understanding the stats may take extra study. And obviously, being a lecturer at university, I always encourage you to think of more study. I think it's a great thing. But if the stats are difficult to understand, what I'd say is look at the tables and graphs and what they're reporting for changes pre and post intervention. And it's likely that if you work in this area, that you'll you may know the assessments they're using, and so you may have a sense of the degree of change that they're describing. You can then triangulate this information with the first paragraph of the article's discussion, which is often a clear, plain language summary of the article, and that should give you a sense of what they're saying. So we're near the end of our whistle-stop appraisal here. In the discussion of the article, the authors will discuss what they think the implications of the work are, but this is where you need to be really thinking, what are the implications for me? How has what they have done, how is that relevant to me? And I guess a key message I want to get across here is that critical appraisal, I think it is much more possible than you maybe think. And so I think really try this out and ask those kind of questions. And you could even find that it turns into quite an interesting kind of detective activity after you give it a go. So on that note, I'm going to hand you back over to Emma, and she's going to help guide you through some ways that you can take this information forward.
Thank you very much, Jenny, and hello everybody. So, as you heard from Derek, our aim today is that you leave this webinar with a toolkit of knowledge, tips and resources that make it much easier for you now to go out and get the evidence that's really relevant to you. So to follow on from what Jenny has shown you, I'm going to take you on a tour of tools and suggestions to help you take this forwards. So how do I find the evidence? Well, the first thing I'm going to do is signpost you to a few key places. So as Jenny mentioned, if you're a member of the RCSLT, the Research Centre is a good place to start, and you'll find that in the members area of our website. You can reach it from the drop-down menu there, and once you're in the Research Centre, you'll see a whole range of sections on the left-hand side of the page. And the most relevant bits for today are the pages around finding evidence and evidence-based practice and the journals collection. And all the links that we have mentioned today will be found in the Research Centre. The first tip I'm going to give you is about signing up to content alerts. And this is really an easy way for you to keep up to date with evidence in your field. And it means that the evidence is then delivered directly to your inbox, and then you have links that you can go straight to the research articles. And the way you do this is you need to go to the home page for the journal that you're interested in. And on that homepage, for example, here we've got Child Language Teaching and Therapy. You will find an icon or an item there that says something like email alerts or e-alerts or content alerts. And all you'll need to do then is click on here and register. And as soon as a new article is published, it'll come straight into your inbox. If you want to know more about how to do this, then click on this link on this slide or check out our How to Sign Up to Journal Content Alerts on our website. So if you're searching for evidence to answer a particular question rather than having it delivered to you, here are the databases that Jenny mentioned, and here are the links for all of them. So Speechbite is dedicated to speech and language therapy intervention research. And actually, this is often the first place I go to if I'm looking for information like this, because it's a very user-friendly website, and it's kept up to date by a team in Australia. So there is a slight time lag between when an article is published and when it appears on Speechbite. Another good thing about Speechbite is that it uses the research design terminology that Jenny showed you on the pyramid. So for every research article, it will tell you what the research design was. And then you have a bit of a head start because you know straight away what type of research it was. Other databases are PubMed and Google Scholar, and these are all open access as well that you can use for free. There are also more specific databases. So this one here is AAC Knowledge, and it's been developed by Communication Matters. And this website is specifically around AAC and is an open access tool that's been designed for both users of AAC and professionals. And in that way, it's quite unusual that it's well used by practitioners. Websites also exist that gather together evidence-based interventions. So instead of evidence being listed by research article, on these websites, you'll be able to search by intervention, and they will include information around the evidence base for that particular intervention. So one example here is What Works, and that includes interventions for speech, language and communication for children. And it has very clear criteria for inclusion on this website. So only interventions that have published evidence will be found here, and they are graded in terms of the level of evidence behind them. So some will have strong evidence, some will have moderate, and some will have indicative levels of evidence. That's not to say that interventions that are not currently on what works don't work. It just means that they haven't been evaluated yet, perhaps, or that the evidence hasn't been published yet. Evidence for impact, the other one here, is relevant to education interventions, and the Early Intervention Foundation's guidebook, which you can also see on this slide, includes evidence relating to a wide spectrum of early interventions. Okay, so now we've talked a bit about how to find the evidence, so how you can get the evidence delivered straight to you and where to go out and find it. But the next step is to be able to access the research, so you can really get to grips with it. And as this slide shows, staff employed by the NHS or university will have access to a wider range of research and journal articles. And you can do this through the collections in the libraries and also through having an Athens account. And if anyone isn't sure about how to do that, please check out our Finding Evidence webpage or contact me. However, having said that, we know from members and also from the questions received before this webinar today that many of you are still finding accessing evidence really challenging. And as I'd like to show you now, we are working hard at the RCSLT to try and fill these gaps. The first thing to always check when you find a research article is whether it's open access. And you'll be able to tell this from the word open next to the title or an unlock padlock, for example. And this just means that anyone can download the research for free. Some journals are fully open access, which is great, whereas others will just publish a few articles that are open access, and that tends to be around who funded the research. But as you may have noticed, there is a big drive for more open access research now, and so everything is changing rapidly. For example, from April next year, universities will be required to make much more of their research open access. So do watch this space. In our research centre, there is also a list of open access journal titles. So if you're a member of the RCSLT, there is more good news because you now have access to a much wider range of journal titles, as Jenny mentioned. And these are titles that are relevant to our profession and also include a wider collection of health-related and education-related research. You can get directly to the journals collection by clicking on the picture here on this slide that appears on our homepage. And you can also get to it through our journals collection, our research centre. So to get full access to the journals, you must go through our website. So what does the evidence mean for me? We know that finding and accessing evidence is just the start of the process, and this is really the next question for us. And when it comes to looking at a research article, Jenny has shown us that it's really, really helpful to use a checklist because it guides your thinking about the research. And you've seen the RCSLT critical appraisal tool in action, but there are other checklists, and this collection is a series of open access tools that can be downloaded. And they are particularly useful if you're looking for a certain type of research, so say a systematic review or a qualitative research study. And each checklist will have a series of 10 questions to guide you through the paper, and they will help you assess the quality of the research that's been done, but also make sure you're thinking all the time about how applicable it is to your particular clinical situation. And when you're thinking about evidence, it's important to think of it all as part of a bigger picture. So our focus today has been about finding the evidence for real life clinical questions, but what we really want you to do is put this really at the heart of your clinical decision making. And we know this can be challenging because you have many factors to take account of. So the context you're working in, the person you're working with, as well as your clinical experience and expertise. So that's why, because it's different for everyone, it's important for you to look at the evidence really carefully before you apply it to your situation. And one tool that can really help guide you through this process is our evidence-based clinical decision-making tool, which is an e-learning tool on our website, which we've made open access for everyone. And it guides you step by step right from the beginning, from your assessment and diagnosis through to selecting an intervention and evaluating it. And it talks about different scenarios, so where there may be a limited evidence base and where there's more evidence. And you can go back to this resource as many times as you need. And the last thing I'd like to say is, through all these endeavours, you are definitely not alone, because we know that clinical questions do involve looking at perhaps more than one research study. It can be time consuming, so your colleagues are going to be a great resource to you, your colleagues in clinical excellence networks and your local groups, for example, to share the load and have these discussions around the evidence that are so critical. You can think about talking to your local RCSLT research champion as well, because part of their role is really to support others on how to apply evidence to practice. And there are other sources of support, for example, the Council for HP Research Hubs, shown on the map here, who often run journal clubs and events about applying evidence. And we are here to help you too. So if you have any questions at all about what we've covered today, please don't hesitate to contact us. And really now it's over to you. And so we've hopefully given you lots of tips and resources. So it might be worth going out and trying and putting them into practice straight away, maybe when they're still fresh in your mind and thinking about a key clinical question that you have. It would be great if you could spread the word about this webinar to your colleagues, because all the slides will be available to members and non-members, as we've said. And all that remains now is for me to say thank you very much for listening, and we're looking forward to answering your questions now.
Thank you very much to Jenny, and thank you very much to Emma. You'll have seen that some questions are being responded to live and interactively in a way which makes a middle-aged man like me very excited. We also have some questions which, as is traditional, have been sent in advance. So I'm going to kick off with a couple of those, if I may. The first one begins talking specifically and mentions LSVT and intensive aphasia therapy, but then says there's very little evidence of other therapies, and then asks a more general question: how can clinicians start practice-based evidence? Emma, have you got any thoughts on that?
Well, we were really glad that we received this question, because obviously a big part of our work is to try and support speech and language therapists to start gathering evidence themselves. And what I'd really say here is the key thing here is probably to start small, so you're not overwhelmed with the degree of the work involved, but also to have a really clear question in mind about what you want to collect in terms of evidence. And there are resources and pointers to help you formulate a good question, to make sure that you include everything that you need, so the people you're working with, the intervention and the outcomes, and any controls that you may have heard of the PICO framework. And there's more information about that in our research centre. And in fact, there are quite a lot of resources in there to help speech and language therapists think about collecting evidence. But one thing I did want to say is that there are lots of examples that I've become aware of recently of people doing this kind of thing together, whether it's in a service. So, for example, there was a team in Nottinghamshire recently who did a year of evaluation. And so they all did a piece of practice-based evidence that was assistants and speech and language therapists. And what they were able to do then is collect this huge body of evidence that was very much rooted in their practice. And they've been able to change how they're delivering their service as a result. And if you're interested in that, do contact me, because I can put you in touch with them. And there are other examples where whole teams have done single case studies, which is something that's actually relatively easy to do alongside practice, but you just have to think quite carefully about how you do it. And again, there are quite a lot of resources in the research centre to help you. And other SENs, for example, have invited a researcher to come along to talk to them about research questions. Or in fact, maybe somebody in the SEN is doing a PhD, and then what they've done is managed to work together either to collect data or maybe to do some consensus work around real clinical practice in relation to a particular client group. Did you have anything to add, Jenny?
Yeah, well, actually, one thing I would add is also, I mean, earlier we were talking about kind of control groups and these kind of things, but you don't need to, you can actually develop evidence without having to have separate control groups. If you have some clients, they can become their own control. So you can maybe do an assessment, collect a baseline, and then either deliver something as usual or not give, or the person is on the kind of waiting list waiting for intervention for, say, about 4 weeks. You then assess them again to see the level of change without the intervention that you're interested in, and then you can bring that in for, say, 4 weeks, assess again. So in that way, you don't need to worry about kind of finding extra control people. The clients can actually act as their own control.
That's great. Thanks, both. Another question that we had in advance is about the issue of outcome measures, which is a topic we talk about a lot here at RCSLT. And the question is, how robust are the outcome measures typically used in SLT research? And what kinds of outcome measures are most meaningful in SLT research? Jenny, do you want to kick off on that one?
Sure. Well, we could have a whole webinar on this question. I think it's really important. Obviously, within SLT, we have kind of diagnostic assessments, we have custom-made assessments that you may use in research, and then we have broader outcome measure variables. These all have a different place within our profession in terms of providing evidence, and so they all are robust in different situations. It's hard to actually say whether an outcome measure itself is robust or not. I think it really does depend. We need to be thinking, well, what do I want to know? And then if you know what an outcome measure is, you can think, well, do I think that that's going to be sensitive enough to indicate change in, to the degree that I'm interested in. So it's, in a way, you've kind of got to take the outcome measure, think about what you want out of it, and evaluate it in that way. Emma, I don't know if you have anything to add.
I was just going to say, it is really useful, actually, when you're using one of these checklists, for example, to look carefully at what outcomes have been measured, because you might be interested in outcomes that perhaps the researchers haven't considered, wider stuff around participation that would lead you to think about quite carefully about the research and what they found. But it's quite useful to think in those sort of levels that was mentioned in this question about the outcomes that are relevant to the therapist, to the family, and also, what difference it's going to make to their lives ultimately.
Thank you both very much for that. We have no further questions. So that being the case, I'm minded to draw us to a close and give you all back 5 minutes of your life. Thank you very much for joining us on today's webinar. As mentioned, both the slides and the recording will be online in the next few days. Please do come back to us with any feedback. There'll be a feedback form, I think, popping up on your screen quite soon after. And we hope to have you joining us on a webinar sometime again soon. Thank you very much and good afternoon.